Hello, I'm Dr. Craig Escude. I'm the president of IntellectAbility, and today we're going to talk about health risk-informed telemedicine, a model for improving health equity for people with intellectual and developmental disabilities. Our company, IntellectAbility, consists of three service brands: our health risk screening tool, which is a web-based tool that screens for health risks for people with IDD and provides action steps to mitigate those health risks. Our Academy division is an e-learning division that's filled with a number of courses designed to teach supporters how to identify common health problems and what to do to help lower risks associated with them. And our person-centered services division provides training to states and organizations to help them provide person-centered support to people that they are providing services for. So I do want to touch just a little bit about health disparities. We know that people with intellectual and developmental disabilities have a number of health disparities. These are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. In the past year, in 2022, there have been a number of very prominent calls to action to address health equity for people with intellectual and developmental disabilities. The National Council on Disabilities Health Equity Framework for People with Disabilities was released in February of 2022. There were a number of items in the report that were designed to help improve health equity for people with IDD. Just to touch on a few of them, they were to help to have people with disabilities designated as especially medically underserved population, to also require comprehensive disability care curricula in U.S. medical nursing schools and health professional schools, to use accessible diagnostic equipment, so on and so forth. Another prominent release that occurred in 2022 was from the Joint Commission. They are a large accrediting body of health agencies and hospitals, and they released a sentinel event alert related to diagnostic overshadowing. This is something that we commonly see in healthcare for people with intellectual and developmental disabilities. A good example of that is where a person might start to exhibit some sort of adverse behavior. And the thought might be, well, they're doing this just because they have a disability, and without ever really looking for some underlying treatable cause, such as pain from maybe a stomach problem or a dental abscess. And so that overall diagnosis of intellectual disability overshadows another potentially treatable diagnosis. So this Sentinel event alert was geared to warn clinicians about this particular problem. The third big release last year was the Global Report on Health Equity for Persons with Disabilities from the World Health Organization. It was a very large document, but spoke very much to improving structural factors and social determinants of health, and talked about health system factors delivery and education and training for clinicians as well to improve health equity for people with IDD. We also saw a study in 2021 that was published that surveyed a number of physicians about their perceptions of people with disability and their health care. And striking numbers there, 82% of physicians reported that people with disabilities have a worse quality of life. 41% of physicians, or only 41% of physicians, were very confident in their ability to provide the same quality of care to patients with a disability, and only 57% strongly agreed that they welcomed patients with a disability into their practice. These are pretty interesting numbers, because what we'd like to see is that every clinician will welcome people with disabilities into their practice, and everyone feels confident to be able to provide the same level of care to a patient with a disability as to one without. We know that when healthcare needs for people with IDD are not addressed, we can see an increase in chronic disease burden, increase in overall health risks, increase in emergency department visits, hospital admissions, functional disability, acute healthcare costs, and long-term services and supports and waiver costs. And then we can see a decrease in the quality of life for a person, decrease in the overall health of the Medicaid program, We see a decrease in the opportunities to what we call bend the cost trend. And also we can see a decrease in the health of the state's population overall. Now, what we're talking about here today is health risk-informed telemedicine, and this is designed to help improve access to IDD-trained clinicians that are informed about a person's health risk, which can improve health equity for people with intellectual and developmental disabilities. Health risk-informed telemedicine, or HRIT, consists of three components. First is clinician training. Second component is telemedicine access by IDD-trained clinicians. And the third component is health risk information being available to the clinician at the time of the visit. So let's take a little bit of a deeper dive into each of these. So let's talk about clinician training. Now, health risk-informed telemedicine is currently something that we're doing in conjunction, IntellectAbility is doing in conjunction with StationMD. All of the StationMD clinicians go through a course that we created called the Curriculum in IDD Healthcare. It is a web-based course that is approved for continuing medical education units and continuing nursing education units that teaches the fundamentals of providing healthcare for people with intellectual and developmental disabilities to clinicians. This course is currently used by other states and agencies and medical and nursing schools to train clinicians as well. So that's the clinician training part of it. And you can add to that in terms of StationMD, their vast experience in providing healthcare for people with intellectual and developmental disabilities certainly adds to their clinical competency in this field. The second component is telemedicine services. You can't have health risk-informed telemedicine without having telemedicine services available. So again, we've partnered with StationMD. They are a group of clinicians founded by emergency room doctors, and they're specifically focused and trained, as I mentioned earlier, to provide healthcare for people with intellectual and developmental disabilities. They're currently in 22 states, over 34,000 lives covered, and that number is growing. When we think about the ER experience for people with intellectual and developmental disabilities, it can be quite frightening. There's what we call the trauma of transport, where you maybe get a person ready to be transported, and sometimes it requires a different staff and other people to come in. Sometimes it requires the whole house maybe to have to go to the visit, and there's a lot of moving parts that have to happen during this transport process, which can be traumatic on a number of levels. People who go to emergency departments can be exposed to other things as well, such as COVID-19. It certainly can disrupt the routine of a person. None of us really like to have to go to the ER. And it can also result in missed medications. Sometimes a person might miss some seizure medicines and they end up having seizures because of this as well. And it can take a long time to stabilize a person after an event like this as well. So when we look at a good solution for that, telemedicine can help with a lot of these components here. When we talk about lack of access in general to clinicians who are trained, telehealth removes these geographic impediments. Basically, anywhere you can get a cell phone service or an internet, you can have a telehealth visit. Suboptimal care currently exists for people with special needs, and the clinicians there, again, are trained and have experience in providing healthcare to people with intellectual and developmental disabilities. Sometimes the primary care physicians might not be available around the clock, but telehealth in this option is available 24 hours a day. Sometimes there are regulatory pressures where maybe your program might have a protocol say anytime a person bumps their head, they have to be evaluated by a physician. Well, that can be accomplished in this manner by a telehealth visit, and then the telehealth clinician can determine, well, this person does need to go see someone or they don't. And they also provide a lot of documentation to their visits as well, too. So one of the really nice and cool things is that the outcomes that have been shown by StationMD over the last several years show around 90% of the calls that they get can be handled in place, meaning just the telehealth visit can handle that particular problem. thereby most likely reducing the number of unnecessary traumatic and cumbersome healthcare visits to emergency rooms. So that's pretty impressive. So that's the second component. So let's talk about the third component of health risk informed telemedicine, and that's having the health risk information being made available. So where does that health risk information come? First of all, it comes from the health risk screening tool. The health risk screening tool is IntellectAbility's tool that is designed and developed to screen for health risks, primarily in people with intellectual and developmental disabilities, as well as other disabilities as well. It is used throughout the country in about 26 different states. There are 7 states that mandate it across the entire intellectual and developmental disability waiver population as well. It's a widely used tool. So how does it work? There are 22 items on this scale that help determine the risk of illness and health destabilization. This is not something that has to be completed by a nurse. Once the screening is done, there's an overall healthcare level that is assigned to the person from level 1, which is the low risk, to 6, which is high risk. We'll talk a little bit more about that in a minute. It also identifies specific health risks in those 22 different areas that can guide the provision of healthcare and support and surveillance. And one of the most exciting parts of this tool is, while it's nice to know what the health risks are, the tool also provides action steps that supporters can take to help minimize and reduce the health risks that are identified by the tool. That's pretty exciting. So here's a list of the 22 areas that the health risk screening tool screens for. So we look at things like eating, which we know if people have trouble eating, there can be more risk for aspiration, walking, transferring, going to the bathroom. It looks at behaviors and aggressive behavior and self-abusive behavior, all of which can be signs of underlying undiagnosed health conditions. It looks at common areas where we see more health problems in people with disabilities, such as stomach problems and seizures and certain medications that people take, and bowel functioning, nutrition. It looks at injuries and falls, and also the frequency of services to emergency rooms and hospitalizations and professional healthcare visits and all of those. So once a person is fully screened in each of these areas, the person is then assigned an overall healthcare level. That's those levels 1 through 6, with 1 and 2 being low risk, 3 and 4 being moderate risk, 5 and 6 being high risk. Those healthcare levels have been extensively studied over a number of years in a large number of people with intellectual and developmental disabilities. And it was determined that the overall healthcare levels are predictive of the risk of mortality. And each 1 point increase, so if a person goes from a healthcare level, say 2 to a 3, or a 3 to a 4, each 1 point increase in that healthcare level is associated with a statistically significant increase in the risk of that person dying. And we're talking, and it's varied in different years, but 60, 70, 80, 90% higher risk of dying with each 1 point increase in overall healthcare level. So it's definitely something to pay attention to. So when we look at the 3 components and we look at the health risk screening tool, there is an enormous amount of data in the health risk screening tool. We know as healthcare providers, and being a physician myself, we don't always have the time to go through an entire book of information and lots and lots of data during a healthcare visit. So we want to know, what are the really key points? What are the important things to focus on? So we at IntellectAbility created the clinical relevance document. So this is a document that gives a concise picture of the overall healthcare level, as you can see on the top here. What those healthcare levels mean. So a person may not be that familiar with the health risk screening tool, but they can look at the chart and see, okay, this person is at really high risk because they're at a level of 6. And then in each of the 22 areas, you also see that person's score in the area, and it tells you how they go from 0 to 4. And as the score increases, it tells you what is the clinical relevance or the clinical significance of that score being on the higher side. For instance, in the example here in eating, that person scores a 3 out of a total of 4. And the higher the score, that means there's an increased risk of aspiration and choking. Now, how might this help a clinician? Well, if a clinician is doing a telehealth visit and a person gets called, a person is experiencing a cough and a fever, if they may look at the eating scale, and if the eating scale shows a 0 risk, then they're probably at very low risk for something like aspiration pneumonia. But if the eating scale shows a 4, they may be at much higher risk for aspiration pneumonia, and this may guide the clinician to make different clinical decisions, maybe to use a different type of antibiotic if they decide that that is what's indicated, or that the person might need to be transferred for further evaluation because they have a greater risk of potentially more serious conditions. So this is kind of just an example of the rest of the clinical relevance form. And what we've done at IntellectAbility with StationMD is we have built an interface to where the StationMD software becomes auto-populated with the health risk screening tool information anytime they see a person who has a completed health risk screening tool once it's turned on. So this is what it looks like in the StationMD software, and you can see in the green here on the left, it says, I have reviewed the patient's health risk screening tool, which lists the patients as having an overall healthcare level of 6, which is the highest risk. And then it highlights the areas that a person scores 3 or 4 in to call those areas to the attention of the clinician to aid in their clinical decision making. You can see on the right half of that screen, you'll see the healthcare level is indicated in red there, and they're color coded depending on which level they are. If the physician or clinician wants to look in more detail at the clinical relevance document that you saw earlier, all they have to do is click that button next to the red box. It says Clinical Relevance PDF, and that document pops up, and they can look at the exact scores in each of the areas and see what it means clinically. If they want to delve even further into it, they can click the next button over to the right where it says HRST PDF, and they can get the full expanded scoring summary that has a lot more information about each of these areas and conditions that can again help with their clinical decision making. So to recap, health risk informed telemedicine consists of clinician training, telemedicine access by IDD trained clinicians, and the health risk information from the health risk screening tool being made available to the clinicians at the time of the visit to inform their clinical decision making. But wait, there's more. So what we can also do when the system is made available to you is the clinical relevance document that we showed earlier, that can also be printed out, or it can be electronically sent to any healthcare provider, making this valuable health risk profile available to any clinician. So let's say the person, maybe even if they have a telehealth visit, and maybe the telehealth clinician says, hey, you need to go to the ER, or maybe they're just going to the ER for some other reason, or maybe they're going to their regular primary care doctor. That document can be taken with the person to the healthcare provider, and the healthcare provider will then be able to use that document in their training, in their evaluation and treatment of that person. We call this health risk informed medicine, just not taking the telemedicine part out of it. So if you'd like to get started with health risk informed telemedicine services, you need to have StationMD services. You need to utilize the health risk screening tool and complete those screenings, and complete them as accurately as you possibly can, because clinical decisions are being made based on this data. And then simply let us know that you'd like to begin health risk informed telemedicine. And that is about it. So I hope this was helpful to help inform you about what health risk informed telemedicine is. We're always happy for you to reach out to us if you should have any questions. You can visit our website at replacingrisk.com. Feel free to email me directly. If you need the information about StationMD, you can see Dr. Unadkot's information there. and you can email him as well. So thank you very much for spending a few minutes with me today to learn about health risk informed telemedicine.